Christina is from the Family Caregiver Alliance, a great organization. I've probably known her for coming up on 20 years now. She's absolutely terrific, which is why at every caregiver event I've ever had, Christina's always here to give a talk. So she's going to be talking about relationships, caregiver, stress, and resources. Take it away.
All right. Welcome back, folks, for those who are here, as well as those who are online. As Robin said, I'm with Family Caregiver Alliance. We are a nonprofit that really focuses on working with family caregivers. So I've been with FCA for about 19 years now. And we know that the challenges that caregivers face can vary quite a bit. And it can also last for a really long time. So we're going to talk about some of the challenges of caregiving. How do you identify what your needs are? And then looking at what are some of those resources and supports that are available? How do you find them? How do you use them? And so hopefully some practical tools that you can leave with today to know what are some steps that I can take to support me in this caregiving journey. So as we get started, I just want to start from the place of just recognizing that caregiving is stressful. And a lot of times, because of the very definition of caregiving, often your focus is on the person that you're caring for. And it can be very hard to step back and actually think about, well, how am I doing? And often we'll talk with caregivers and we'll say, well, how are you? And they're just like, I don't know. I haven't really thought about it. I haven't had time to kind of reflect on how this might be impacting me. So we're going to look at, what are some of those ways that you can think about yourself for a little bit. And so starting from this place of even just knowing, how does stress show up for you? And I'm going to come back to this at the end, but I want you to think about, like, what does stress really look like for you? For some people, it can be very cognitive. It's lots of worries. People talk about sometimes that hamster wheel in the brain of just like those thoughts that do not ever quiet down. Sometimes caregivers will report that they notice problems with their own memory and thinking. They might be caring for someone who has those symptoms, but because of stress and all the things that you're trying to juggle, sometimes caregivers will say, I feel like I'm starting to lose it. And that, again, those constant worried, anxious thoughts. For others, stress might be more physical. You might get that shoulder tension, the stomach aches, the headaches, and you might really feel the stress physically in your body. Sometimes it's that heart rate increase and the high blood pressure that can come with stress. Or it could be more emotional. This is where we sometimes get a little bit more irritable, a little cranky at times. We might notice kind of increase in anxiety or depression, or it can show up in our behaviors. Are we having changes in sleeping or eating? And for some people, that's eating more or eating less, or sleeping more or sleeping less. And so it's really about kind of knowing what's normal for you and when do things start to change. And the reason why this is really important to think about is this helps identify when you might need more support, when this might be getting challenging or difficult or overwhelming, and then knowing what type of support would be most helpful for you. So think about, again, how does this show up for me? What does this look like? And we're going to kind of circle back to this as we talk about kind of resources and supports as well. So again, lots of challenges that caregivers are facing. I don't think there's anything on the slide that is going to be a surprise to anybody here. Some of the challenges of caregiving is all the multiple roles. You might be caring for a loved one and have kids, or also working, or trying to take care of your health, or managing the household. So it's all of these different demands on your time and your attention. It's also expensive to provide care. Even with things that insurance does cover, there might be copays or out-of-pocket expenses. And then there's all the costs of caregiving that often don't have any coverage. So for those who are here in the room, if you have not availed yourself of the table in the back of incontinence supplies and other resources, take advantage of them, because that can be a huge expense that you are going through on a daily basis. Cost of home care, cost of long-term care. If you're trying to access other community supports, what's available for free, what's not. And then the challenges of whatever the disease or diagnosis that you're caring for. So there might be specific symptoms that are really difficult. So somebody who is having more falls or might have some incontinence or problems with sleeping, and how does that impact you as the caregiver? Or if there are any cognitive symptoms as well. And unfortunately, our care systems, our healthcare and our social service systems are not well coordinated. They are very difficult to manage and navigate. And that challenge really falls on the caregiver to try and figure out, how do you even know what's available? How do you get to those specialists that you need? What's actually covered by my insurance? And there's not nearly enough help, either from our systems and then oftentimes from other family members or friends. Is there the help and support that you need? And then this came up a bit this morning, that sense of lack of control or uncertainty. Even with diseases where we have a diagnosis, we kind of know how they progress. We don't always know, what is that going to look like for my family member? What's the time frame? How long are we going to be doing this for? What are those decisions that I'm going to have to make? And when am I going to need to make them? And so all of that uncertainty is part of the challenge for caregiving, and is what can really make it difficult to figure out day to day, what do I need? What's going to be helpful for me? Some of the other stressors and challenges that caregivers face can actually be really internal. It's, how are we processing the caregiving experience? How are we thinking about it? And Dr. Larson mentioned a little bit this morning, but the grief and loss that comes with caregiving. There is a grief writer who said, anytime there's a change, there can be a loss. And when there's a loss, there is grief. There are changes that happen with these diagnoses, and we experience these losses over the course of the disease progression. So there's this idea of anticipatory grief, that we know what's coming. Either we know the progression, that there's going to be more functional changes, more losses that are going to come down the road, or even thinking ahead that we know at some point this person is going to pass. And so we are often anticipating these losses, and we start grieving for them while the person is still here with us, because we're thinking about those changes that are to come and those losses that are to come. And then there's this concept called ambiguous loss. The idea that somebody can be here and sitting right next to us and with us, and they are not the same person that they were before. Our relationship with them may be different than it was before. We may feel like we're different than we were before. And that ambiguity of, they're here, I'm here, we're still together, and yet I'm feeling this loss and this grief over this person in this relationship, even when they're with me. And that can be a struggle to really think about, how do I cope with that? We don't have greeting cards for ambiguous or loss or anticipatory grief. There's no, oh, I'm sorry that the person you're caring for is experiencing this progressive condition and your relationship's changing and they're changing and you're changing. It doesn't fit on a greeting card really well. So we don't always have ways to cope with these things and talk about them. And that can lead to feelings of isolation for caregivers, kind of that unresolved grief that we're sitting with, and not always knowing how to talk about caregiving with people who are not also going through it and living it and understanding that experience. The other kind of emotion that can really weigh on caregivers and add to some of that stress is guilt. And guilt is one of those things that we hear so often from families. Either this idea that if I start to think about myself and try and do things that are good for me, well, that's selfish, because they're the ones with the illness. They're the ones who are needing help. So I shouldn't be focused on myself. There can also be a lot of ambivalence with caregiving, that this is somebody I care for and I want to take care of them, and I'm going to be here to take care of them. And I really wish I didn't have to do this. And this is not what I had planned for this time of my life. And I didn't think that this is how things were going to go. And sometimes those feelings can create that feeling of guilt, like, oh my gosh, I shouldn't say that. As opposed to saying, well, that's normal. Of course, nobody wanted this. Nobody wanted this diagnosis. And that does not take away at all from the care that you provide. To say that sometimes, I wish this wasn't our life right now, that this was not what we were having to do. And then all the shoulds. I should have been able to stop them from falling. I should be able to get everything done today. I should have, been able to follow up on the doctor's orders. I should be more patient all the time. All the shoulds. This idea again of that superpower that we are able to do everything all the time. And so when we have these feelings of guilt come up, it can be helpful to think about, like, is this actually something that I should feel guilty about? Have I done something wrong? Guilt can be a healthy feeling if we've done something to hurt or harm or offend another person. It says, I need to make amends. I need to say, I'm sorry. Or is this sorrow about these circumstances that are outside of our control? That there is this progressive condition, that we are having to provide care, that we are having to balance our needs and their needs at times, that we are not perfect people who are going to be able to do everything all the time, always. And so often what we're feeling is a little bit more of regret, that this is our reality right now. And so how do we help reframe for ourselves that, is this something I really need to feel guilty about? Or is this part of that grief and loss and sorrow about some of the challenges of our current reality? There is a woman, she took care of her mom with Alzheimer's. She had been a children's author. And so she wrote a number of books of poetry about caregiving. Her name is Frances Kakugawa, and she had one that came out during COVID called Imperfection. And she says, we are caregivers, perfect in our imperfections. So we are not going to get it perfect and right all the time. And yet the act of being a caregiver and showing up and being there for somebody is perfect in that moment. It is as much as you can do. And that showing up and being there for somebody, even when you're maybe not always wanting to and you're having a hard day, that the fact that you are showing up is huge. And it is such a value to the other person. So given all of these challenges, these stressors, these difficult emotions that can come with caregiving, having support, having resources is so very important. And before I even get into all of these, I'm going to say the sooner the better with anything. And there are times that you might say, okay, well, we're doing okay right now, and I don't think I quite need it yet, but I can see that time coming. That is the perfect time to start exploring what's available. Because when you really need it, when you absolutely have to have home care, or you're needing more medical support, or you're needing breaks or emotional support, that can feel like just one more thing to have to try and navigate and access. So starting to explore those options before you really need it can ease a little bit of that stress in that moment when you say, all right, now is definitely the time, and you don't want to have to make those calls and deal with potentially wait lists or explore resources. So starting early, and earlier than you think you need to. Not to say that you have to use everything, but just to know what's out there. So we're going to talk about kind of it in these three areas of what some of that information that you need as a caregiver. So how do you find it? Really to help support you in those moments of uncertainty, of not really knowing what should I do? Am I doing it right? To know what are those resources that can help you understand the care needs, understand caregiving a little bit better. What are some of the ways that you can get help, either from family or friends or from formal systems? And then that emotional support really for you as the caregiver. And what's really important in all of this is not just about how to help you be a better caregiver, but is how to also just take care of yourself as a person. Outside of your role as a caregiver, you have value, and your health and well-being is just as important to consider. So there may be things that are going to help you take care of your loved one, but there may be times as well that you're looking for that support just to help you. And they will benefit from that. We tend to be a little bit more patient, a little bit able to navigate things when we are well taken care of. So they will benefit from it, but it can also just be because you need it for your own health and well-being. So we're going to start talking about these around information. And today is a great start, to be able to hear about what are the symptoms of these diseases? How do we manage it? What does that look like? So really understanding the diagnosis. And I know that especially for these conditions, just getting a diagnosis can be the hard part. Like that may be taking a really long time. But when you do have it, or you have like guesses, maybe educated guesses, but guesses as to what it is, really reaching out for that information about how do I understand this disease? What does it mean? And knowing that there can be variability. It's not going to look the same for every person, but there are maybe common symptoms and common ways it progresses. And depending on who your healthcare team is, some are better at helping you kind of understand that long-term trajectory than others. So really reaching out for what are those supports? How do I get that information to understand the disease? And so Brain Support Network, all their resources, these types of workshops, you take advantage of those. And also know that it's okay to sometimes push a little bit with your healthcare provider. If you feel like you're not getting the information that you need, and sometimes it's from a place of good intention of, I don't want to say something that may not be true for your particular situation. And yet you can say, okay, but tell me what the averages are. Tell me what you tend to see. And sometimes we do have to push a little bit with our providers to make sure that we're getting kind of as clear of information as we can. Making sure you understand the medications. And again, okay to kind of advocate. I've had caregivers say, well, we have to give this medication every 4 hours, which means I'm waking up every 4 hours in the middle of the night to give it. And it's like, okay, that's hard. Have you talked about, are there other options? Are there other ways? And maybe not, but have you had that conversation? So making sure that you really understand the medications that somebody's on, if you're taking supplements or vitamins, if you had those conversations. This is where, outside of just your healthcare provider, pharmacists can be a really helpful resource, whether you need to have a consultation or be able to talk with them when you're picking up the meds, to be able to ask those follow-up questions that maybe in that doctor's appointment, you were too overwhelmed to ask. That's a good place to start, as well as kind of being able to follow back up with your provider. Nurses can be such a great resource in really helping to understand some of those care tasks, especially when you start providing more medical care. When you're helping somebody who's having swallowing issues, maybe somebody who's also diabetic, and you're having to monitor blood sugar for insulin levels, or you're having to check other vital signs. So often families end up having to provide these medical care tasks. And most family caregivers did not go to medical school, did not go to nursing school, did not go to school to be a CNA. And yet families are taking on those roles. So really asking for that help and support to say, I don't know how to do this, and I need to have more training. There are actually now billing codes specifically for caregiver training. So healthcare providers can bill Medicare, Medi-Cal, Medicaid systems to provide training for caregivers, because we know families end up taking on a lot of tasks that nobody has taught them how to do. And those feelings of worry and sometimes fear, am I going to do something wrong, are not feelings that you necessarily have to live with. So there's also a lot of online educational tools, and I think these slides are being sent out. The slides are being sent out. So there's lots of links that will lead you to medication management videos and medical task videos. They're going to be broad. So again, that individual training can be really helpful, but additional tools that are out there. And then in addition to those medical tasks, you may end up helping somebody, transfer from the bed into a wheelchair, or get into a shower, or you're helping them get into a car, or when they have, tremors, and you're helping them try and eat. Again, tasks that you may not have been trained how to do. A lot of these are where occupational therapists and physical therapists really shine. Like that is their expertise to say, all right, what are those challenging day-to-day tasks, that daily care that you are providing? What don't you feel comfortable with? What's hard? And they are in a great position to say, here's the tools that are out there. Here, let's walk through moving from a bed into a wheelchair. Or how do you get into a shower? Or where you might need grab bars or a shower chair. So again, being able to say, this is what's difficult, this is what's stressful, and where I don't feel comfortable providing this level of care, and leaning on those experts to actually give you that guidance and support. And then recognizing, what are the roles in terms of that medical support of palliative care and hospice care. And I know there are brochures because I saw them out there at the Stanford table. And for those who are online, it'll be, I think, part of the packets and on their website. But, palliative care is that additional support that tends to be more holistic for anybody with a serious illness. So helping to better manage symptoms, pain management, and it can really provide a little bit more emotional support sometimes for families, helping them manage kind of that day-to-day care. So palliative care is available, again, any stage of a serious illness. What it looks like depending on your healthcare provider can vary, but that can be a great additional resource when you're caring for someone with these progressive conditions. And then understanding when hospice is appropriate. So hospice is a type of palliative care specifically for people who have 6 months or less to live. And it's often really hard to know when is that appropriate. So talking with the doctor early, does that align with what your goals are, with what your wishes for care are, and making sure that they know if it does so that you're able to access that type of care as soon as it's available. Because unfortunately, too often people are getting access to hospice in just the last couple weeks of their life, as opposed to 6 months or sometimes longer. So really understanding those tools. Family Caregiver Alliance has pulled a lot of these types of educational resources. This handout is actually outside, and then for those online, you'll get this. But if you're looking at needing help around daily care tasks, medical tasks, dealing with dementia, either resources that we have created or that we have created in partnership with other organizations. So thinking about, again, this information is out there. You don't have to know everything that's there, but just to say, this is the part I'm struggling with. This is what's stressful for me. And to be able to ask for that type of support. The other big area of information is around legal planning. And this is the stuff that, frankly, we should all be doing. This is not really unique to a specific illness. It obviously becomes a bit more timely and important when there is a new diagnosis. But is there somebody who can manage finances if you're not able to? Who can help manage your healthcare decisions if you're not able to? And so for those in the room, how many of you have an advanced healthcare directive for the person you're caring for? All right, a handful. How many of you have it for yourself? Okay, a few less. So really important, again, for us to have, and we tend to think about it as caregivers for the people that we're caring for. We're not always good about thinking about it for ourselves. But what if something did happen to me? Who's going to step in and make medical decisions for me? Who's going to help manage my bills, make sure they get paid each month? And these are the type of documents that we need to do before we need to use them. Because usually at the time you need to use them, it's often too late to actually complete them. So if you have not done these documents for yourself, for the people that you're caring for, there are senior legal resources in most counties. There are elder law attorneys, depending on kind of the complexity, especially of a financial assets. There are those resources available to help you get those in place. And if you're not sure what you need, starting with those senior legal programs to say, all right, this is our situation. What are the types of documents? They can help provide some of that guidance before you even necessarily have to get to paying for an individual attorney. And really the goal of all of these types of documents is to avoid conservatorship and guardianship. Because if you reach a point where somebody no longer has capacity to make their own medical decisions or financial decisions, the only role at that point usually is to go through a court system to have someone named. So we want to try and avoid that, having these things in place. Who can access my finances if I'm not able to? So really kind of thinking about, do I understand this? Do we have it in place? If we don't, what do I need to make this happen? And how do we get this available? And then the big one that I'm going to say ahead of time could be an hour presentation in and of itself, but how do you pay for care? What's available? A lot of people think Medicare is going to pay for long-term care, and unfortunately it does not. So Medicare is going to cover your hospital visits, your doctor visits, prescriptions. It's not going to pay for ongoing in-home care. One of the things that does not get used as much under Medicare is the fact that it can pay for durable medical equipment. So do need transfer bench or shower chair, it can be possible to get those covered under Medicare. Certain assistive devices, communication aids, those things can be covered. Sometimes you have to push a little bit. You may have to kind of use those advocacy skills that caregivers really develop to be able to say this is needed, because too often they get denied, and you may have to kind of push for that a little bit. And that's where programs in California, HICAP, which is Health Insurance Counseling and Advocacy Program, they are counselors around Medicare issues, can provide information about appeals and how do you get access to the Medicare benefits that you're entitled to. If you're in another state, they are called SHIP, which is State Health Insurance Programs, because of course we can't call things the same across the country. We all have to have different names, but those exist to help provide some of that support around accessing Medicare benefits and understanding what the coverage should be. Historically, Medicare has not paid for respite services. There is now a program called GUIDE, which stands for Guiding an Enhanced Dementia Experience. There does have to be a dementia diagnosis for those on traditional Medicare, but it does pay now for respite. So it's a still fairly limited program, but it's a new program. So there are additional respite benefits now actually under Medicare. Medi-Cal or Medicaid, I'm going to say take anything I say here a little bit with a grain of salt, because there's a lot up in the air in this area right now. So a lot of questions around coverage and eligibility. But for anybody who's struggling with paying for any sort of long-term care services, in home or out of home, it's worth looking at. There are specific income requirements. There are asset limits in most places. There are not currently asset limits in California. That is likely to change, but how much it will change is still being negotiated at the state level right now. So lots of questions there, but it can cover in-home supportive services. It can cover adult day health programs, long-term skilled nursing facility stay, sometimes assisted living stays under a particular waiver. And a lot of times, particularly for couples, whether you're married or a registered domestic partner, people will say, okay, well, we're not eligible because my income is too high. There is something known in California as the spousal impoverishment law, which provides additional protections for kind of the well spouse or registered domestic partner who does not need Medi-Cal. That the goal is to not impoverish that well spouse, to allow them to maintain some additional assets and income and still have the one needing Medi-Cal qualify. So again, if you feel like, all right, we're really struggling, we don't think we're going to be eligible, it can be worth looking into and at least having that conversation. Again, those senior legal programs can usually help with that. And in California, California Advocates for Nursing Home Reform has some really great Medi-Cal eligibility information, can be very helpful in just understanding what those basics are. Again, come July 1st, there may be some changes. And then come October 1st at the federal level, we may see more. So just know that for the next 5-6 months, there's some questions around Medi-Cal and Medicaid. And then VA benefits. Frequently, veterans will say, well, I don't have a disability related to my military service, so there's nothing I would be eligible for. And that is not often true. There are respite programs through the VA. There may be in-home care, either programs or funding that are not always based on having a service-connected disability. So if you are caring for a veteran or you are a veteran, really good to reach out to your local veteran service office who can help you understand the eligibility and make sure that you're accessing and using any of those VA benefits that you might be eligible for that can help pay for long-term ongoing care. And for those that do have a long-term care insurance policy, and we know that's been a smaller and smaller number, again, really important to reach out to your policy early, because you want to understand what's the eligibility for me to use it. Are there specific criteria that they're going to look for, that they're going to need from the doctor that says, I need help with this many activities of daily living? Is there an eligibility period where you're going to have to pay for care before the policy is going to chip in? What's the maximum? Is it a daily max? Is it hourly max? Is it a yearly max? What's the max? And what does it cover? If it's covering in-home care, does it have to be through an agency? Does it have to be through a licensed provider? So that you understand how you can use it again before you actually really need to use it. And then understanding what are those community resources. And because even in this room, we've got people from lots of different counties, and then I know online people from all over the place, I'm gonna have to talk about this a little bit more broadly and then try and guide you to how do you find it. But knowing that within various counties and communities, there are a lot of different programs that exist. Right now, I think we're seeing sometimes the challenges of how do we make sure people know what's available, what's paid for, what has a cost associated with it. But knowing that there are case management resources, and sometimes these are going to be out-of-pocket costs. Some counties will have case managers, and the role of a case manager is really to help kind of hands-on guide you through resources. They might be helping you fill out applications, making calls to home care agencies, going with you to visit care facilities, or helping to coordinate doctor visits. Meal delivery programs. Do you need something like Meals on Wheels? Would it actually be helpful to go to a congregate site where you and the person that you're caring for can go together and have lunch at like a senior center or community center, just to take that one task off of your daily list? Especially as mobility changes happen, is it difficult to get in and out of the car? Do you need to use things like paratransit services where you have wheelchair accessible vans so that you're not having to try and coordinate and move somebody around to get in and out of, a smaller car that you might have? Some of the counties are actually even utilizing the rideshare programs, and there may be vouchers for those. If there's somebody who can't drive and still wants to be able to get out and do things on their own, but they can't drive themselves. There are some of those programs or taxi vouchers still. And then home modifications. Do you need to have grab bars installed? Do you need a ramp? Do you need to help widen a doorway? There are different programs in different areas and counties that can help actually pay for and complete home modifications to help people really stay at home as their needs change over time. So again, talking about that really broadly, and you might be saying, well, what's available where I live? Most of these programs are funded through the Older Americans Act, and so they're managed through your local area agency on aging. So every county or region is going to have an area agency on aging, and they're going to be managing those programs. So those are places you can always reach out to. In California, there's the Caregiver Resource Centers, either through Family Caregiver Alliance in the Bay Area or others throughout the state. And then we also have a national resource database to help people connect to those programs wherever they live. And then in a crisis, knowing that there are places like Adult Protective Services, if you're worried about abuse, neglect, or self-neglect, if there's someone you feel like they need more care and they are not allowing it, these are social workers that may be able to come in and provide some guidance and support. And then mental health lines, when you need to talk to somebody, when the person you're caring for needs to talk to somebody. Also with the Alzheimer's Association's 24-hour helpline, it does not have to be an Alzheimer's diagnosis. Any sort of dementia, memory loss, cognitive changes, it's a line that you can call at 3 a.m. and say, this is what's going on, and there's someone available to talk to you. And then the friendship line is a crisis and emotional support hotline for older adults as well as for caregivers. So knowing that those programs do exist and are available. And then thinking about how do you engage kind of those family members, friends, how do you encourage them to help out and support? And the first piece is actually knowing what you need. We want to assume that if there's people around us and they recognize that we're caregiving, that they're going to understand what our needs are and they're going to get what the reality is of caregiving. And unfortunately, that's not always the case. They're not always going to get it. So being able to speak up and say, these are the things that would be helpful for me. And as awkward as it may feel, actually having a list, because you might bring up to somebody, actually, if you could come and provide care, stay with, my family members so I can get time off. And they might be saying, oh my gosh, I don't know how to take care of them. I don't know how to help them get to the bathroom. What if they do start choking? I don't know what to do. And so they might be like, oh, can't right now. And now you're not getting any help. But if you were to say, could you go to the grocery store for me? Help make calls to agencies to figure out about resources, help with transportation, come visit with me for a while. If they knew some options of things that would lighten your load and help you out, they are more likely to pick one that they are willing to do and hopefully will do it again. So it doesn't always provide the exact perfect thing, but does it give you more help in your day-to-day life? Using some care coordination sites, shared calendars, ways to kind of keep people on the same page. And then if you need to, think about having a family meeting so that you can get everybody on the same page. They all hear the same information, know what's going on, and you can plan together as a family. And if need be, you might think about social work therapists, case managers to help facilitate those, especially if there's some conflict in the family. You may need to have that neutral third-party person who can help facilitate those meetings. And if the challenge with allowing help is the person you're caring for who either says, I don't need help or I don't want help, start those conversations early. And it might be saying, okay, you may not, but I worry if I'm not here. And so allowing help is going to make me feel better. This is going to ease stress for me. Would you do it for me? And maybe it's a waste of time and we're going to look back and say this was stupid, but right now this would make me feel better. So thinking about what are those ways to bring up introducing care and support that they are more likely to allow and be comfortable with. If you're looking at starting to bring in more formal services, hiring in-home help through a home care agency, finding somebody individually, pros and cons to both, but just understanding what those options mean. That if you're hiring privately, there's going to be a little bit more liability and responsibility on your part. If you're going through an agency, you're probably going to pay a little bit more because they're taking that on. So figuring out what's the right fit for me and what's going to be the right avenue for me to move forward with care. Again, Medi-Cal or Medicaid or VA, there are programs that will help pay for in-home help. So if those are all a possibility, definitely exploring those. And then thinking about other respite options. There are ways to have somebody stay in assisted living or a boarding care home, usually 2-week minimum. But if you're going out of town or you are having your own health issues or surgery, those could be a good option. And then adult day programs can be a great resource for the person you're caring for to get more socialization, more stimulation, more exercise, and for you to get time off. Some of these programs are a little bit more geared towards dementia or cognitive impairment, others are not. So sometimes you have to try it out and do visits to a couple to see which one feels like the right fit, either in terms of their programming or in terms of the other participants, and getting an idea of what feels like it's going to be comfortable. And then there are short-term respite grants. So Family Caregiver Alliance, a lot of disease-specific organizations, Alzheimer's Association will have one, some of the Parkinson's programs will. So reaching out to say, are there grants that are going to help pay for care? And we're going to watch just a little clip on, technology.
So the thing that's most difficult for
I only hear it out of here. Okay.
So the thing that's most difficult for caregivers, I find, is that it's so easy to be focused on the story of the person you're taking care of, their needs, which you're meeting and trying to do and taking care of. And it's hard for people to take the time to say, okay, what's going on with me? Because the reality of the intensity of the situation makes you focus on all that, and you have to do all these things, and you have to learn to take care of yourself. You can't do it forever. You have to have at some point time to take care of yourself, and that's not selfish. That's a good thing. It recharges you. It's what you need, right? And people forget that. Because it's easy because and especially if you're not one to be looking at your emotions, they're going to pop out somewhere with a rude customer service person or something. So it's so important to be, so for social workers, for example, is to be mindful of when somebody's just focused on that, we got to bring it to them and say, well, how do you feel about that? And what are you doing to take care of your feelings?
So that importance on support for you. And that can be breaks and getting support, recognizing that your feelings, all the feelings, are okay. And what are the things that you enjoy outside of being a caregiver? And how do you still maintain at least a little bit of a hold on them? And all of this is about kind of helping build up our resilience. Things are still going to be stressful and hard, but improving our ability to cope with them. And Dr. Larson talked about this morning, so I'm not really going to get into this other than to say this last piece of taking a moment each day to be able to say, what did I do well? What did I accomplish today? Because too often caregivers focus on what was on the to-do list that you didn't get to. What are all the things that you didn't feel like maybe you did well, or the things that you don't feel competent in? But do you ever take a step back to say, what are the things actually I am doing and I did get done? And helping to think through that. So reaching out, whether it's individual counseling, through insurance, through your program, if you're working, some counties are going to have either free or low cost counseling programs. And actually there's this great resource for anybody in California through SCAN, which is a health insurance company, but they open this up to anybody in the state, regardless of your insurance. Free program, 12 to 15 sessions of counseling for any older adult 55 and over, or a caregiver of somebody 55 and over. Huge list of support groups out there. Really encourage people, reach out to the support groups. There's so much that caregivers can learn from each other. And I'm going to skip this one for a second. And then think about what are those things that you need to do to take care of yourself. And they can be small. But going back to, for those who are here for that first slide of how stress shows up for you, when you can match your stress reducing activities to how stress shows up, it can be really helpful. So if your stress is really physical, you've got the tension, the stomach aches, the headaches, then things like exercise, stretching, something physical can be helpful because it's going to release that physical stress. If your stress is all in your, I won't say all in your head like it's not real, but you know, it's the worry and the anxious thoughts and it's all ruminations running through your head, then things that engage your brain. So journaling, reading, prayer or meditation could be helpful. So thinking about how does my stress show up and what are things that I can do that I can fit into my day, 10-minute increments, maybe in 1 minute at a time. You know, you might have 1 minute to listen to a song, watch a funny video, read something online, do a relaxation exercise, but fitting that into your life on a regular basis can make a difference. So I'll leave this here of just knowing that there are resources in California, in every area where someone lives. There is a caregiver resource center like Family Caregiver Alliance. In every state where people live, there is a national family caregiver support program. And so there are those caregiver support resources. What they look like varies, but they exist everywhere. And so if you're not sure where to start, you can always reach out and we can guide people either at the local, state, or national level to how do they find those programs. But thank you all. And I will just acknowledge, like, thank you all for what you do, because it is so much. Outside of the value to the individual person, caregivers provide $600 billion a year worth of care. So our system would not survive without family caregivers. So when you're not sure, is it okay for me to take a break and get support? It's okay for you as a person. It's okay for our whole system, and it is needed in both ways. So thank you all.
Christina. We have one question. We're getting a lot of questions about could you show various slides again, and rest assured everyone will share with you the slides and all the other resources that people have talked about, including Dr. Ng's videos and audios, and everything will be shared. So don't worry about that. Though I know we always worry. I'm going to turn one question that we asked Dr. Ng earlier on back to you. So if a caregiver went into a neurologist's office with their family member with a neurological diagnosis and was obviously in distress and was having a lot of concerns, what would you like to see the neurologist say? Sorry to put you on the spot there.
No, that's okay. I mean, I think ideally, and we're seeing improvement slowly, but improvement in this area of really turning to the caregiver and even just starting with the question of how are you? To have a caregiver be seen and acknowledge that we understand that this is stressful. And then to be like, what are the things that are hard? where do you need more support? And what I've heard sometimes from doctors and healthcare providers say is, well, if I ask that question, I don't know what to give them. I'm not a social worker. I don't know the resources. And it's like, actually, a lot of the questions might be medical. It might be they're concerned about, I don't know how to do these tasks. And that is within your realm, either to answer directly or to connect them with physical therapists, occupational therapists, speech, whoever it might be. So being able to ask somebody, what are the things that are difficult for you? And if it is emotionally, I'm grieving and this is hard. And it's like, all right, well, maybe that's not your patient. But as a doctor, say, if your patient brought that up, what would you suggest? And so you may have to direct them back to their primary care doctor to say, hey, that'd be a good thing to bring up and to ask about, can you get counseling covered? Can you get a referral to a therapist? Do you have a list of support groups, especially if you're working with particular conditions where you're more likely to see caregivers? Or knowing just one place. And when in doubt, we'll say, again, every place has an area agency on aging that is covering community supports and caregiver support, either in-house or contracting. So when doctors don't know where to give somebody as a resource, like that can be one place to potentially start. So thinking about what's one resource I can give somebody, but I think just asking caregivers, how are you doing? What's stressful? To be seen and heard and acknowledged can be so powerful. And again, there's a lot of the questions and concerns and stressors for caregivers are going to be within the medical realm. But if we don't ask the caregiver, what are the things that are difficult for you to do in helping them, then we don't know what we might be able to provide and what information they might need.
Okay, a question, and if you can be brief in your answer, Christina, sorry. Do you have, so this is from a family member whose sister has is caring for the husband. So this is say a sister-in-law to the person with the diagnosis. She says, my sister is extremely reluctant to engage outside help. She's very stubborn. What thoughts do you have?
None of us are stubborn. We're always totally willing to accept help. A lot of it is just exploring. What are your concerns about bringing in home help? What makes you hesitate to do so? And letting people kind of share. Sometimes those concerns are very valid. It's, are they well trained? Are they going to provide good care? I'm going to have to coordinate. That's going to take time and energy. So helping to figure out, like, is this a case of I can support them with getting more information? I can just acknowledge that, yeah, this is going to be stressful and worrisome. Are there ways that then I can step in and maybe help make some calls, kind of help provide some guidance or some training, or at least just allow somebody to kind of explore those. And then to also be able to say, well, I'm worried about you. I know you're worried about him. I'm worried about you. And realize you're not necessarily going to resolve it in one conversation. You may have to come back to this multiple times, but just to start that conversation.
Thank you very much, Christina.
Probably wasn't brief enough for you.
It was never brief enough for me, but it's still wonderful. Okay, thank you very much. All right.